The Miami Peel and the Miami Peel S30, which are part of the Quintessence Skin Science line, are two treatment modalities that I have had tremendous success with in my private practice. These two peels are both extremely effective and very well tolerated light to medium depth peels. They can be used on all skin types within the Fitzpatrick skin type scale. It is not necessary to peel an entire area. Depending on your goal, spot treatments are also an option. Typically, skin types 4, 5, and 6 are difficult to peel and often display hypo or hyperpigmentation or other post-peel skin-related problems. With these two peels, we have not seen these complications and our patients have been extremely satisfied with their results. These two peels are lipophilic, have antioxidant benefits, they are comedolatic, anti-inflammatory, and possess a skin lightening effect. They aid in the effects of photoaging by improving fine lines and wrinkles, while also being a very effective addition to the therapeutic arsenal for treatment of melasma and post-inflammatory hyperpigmentation, secondary to acne and other skin conditions. The Miami Peel is a layered peel and is left on the skin in order to potentiate its lightening effects. The Miami Peel S30 is removed but requires no neutralization whatsoever. They are fast, safe, and effective for use on all ethnic skin types, including Asian, Hispanic, and other skin of color. For advanced practitioners, the Miami Peel and the Miami Peel S30 can also be used in combination with one another in a layering technique, as well as in combination with other procedures such as microdermabrasion and other resurfacing treatments. Before starting these or any other skincare protocols, have your patients fill out the provided medical peel intake questionnaire and pay attention for any physical or psychological concerns or issues before you begin your pre-peel process. Have them sign and take home the post-peel informational sheet along with any at-home post-peel information they require. Always be cautious with the patient who is being peeled for the first time or patients being treated with other skin sensitizing agents such as retinoids. Always remember that peels have a cumulative effect and are performed in a series, with one peel performed every 10 to 14 days for about 6 to 8 sessions to gain maximum benefit. Let me introduce you to our medical esthetician, Beth Miller, who will guide you through these steps of these two peels.
Hello, my name is Beth Miller, and I'm a medical assistant and licensed medical esthetician. I'll be guiding you through the Quintessence Skin Science Miami Peel as well as the Miami Peel S30 today. These two peels are distinctly different from one another in both their application and aftercare. The Miami Peel is a layered peel that's used for its lightening, balancing, and toning effects on the skin and is a very effective anti-aging wrinkle reduction treatment. The bleaching agents together will reduce the appearance of melasma, hyperpigmentation, and photoaging. Up to 5 coats of the Miami Peel may be placed onto the skin with a waiting time of approximately 3 minutes between each layer. The Miami Peel is also beneficial for those who suffer from acne and have oil-dry skin created by overwashing and overstripping the stratum corneum with excessive facial drying agents. Over-drying the skin will create unwanted flaking, milia, inflammation, and produce more oil as an epidermal protective measure. This peel is appropriate for most skin types. The Miami Peel S30 effectively exfoliates and removes dead skin cells, helps stimulate the renewal of the skin, diminishes the appearance of enlarged pores, and helps lighten and even the skin tone. The salicylic acid will aid in the treatment of acne skin conditions and greatly aid in the extraction process. Salicylic acid penetrates the follicle unlike glycolic-based products and dissolves both sebum and comedones caused by problem skin. Its anti-inflammatory benefits will simultaneously aid in the treatment of post-inflammatory hyperpigmentation associated with acne lesions. This peel is self-determining and will neutralize on its own within 3 to 5 minutes. Only a single layer is placed on the face. It's important to evaluate your patient's condition to determine which peel is right for use. The experienced practitioner can use both peels simultaneously. However, this is an advanced peeling technique that is not addressed in this training video. The items used for both peels are a headband, several 4x4 cotton gauze pads, a bowl for water, a timer, a petrolatum-based product for protection in certain sensitive areas, non-latex gloves, Quintessence Skin Science Purifying Cleanser, our green tea toner, Serum C, one clarifying under eye serum capsule, and finally, Quintessence sunscreen. Optional items are a high-frequency unit and a small, soft facial brush. Make sure you have all your tools and products within close proximity and in the order of which they're going to be used so the peel goes smoothly and efficiently. Have your patient place the headband at their hairline. This will keep their hair off their face and away from you as well. Always maintain a clear field to work on. Make sure you fully explain the peel process to your patient and that there are no remaining questions or concerns. Fill your bowl with water and begin the cleansing process. Now, let's begin the Miami peel. Cleanse the face twice with Quintessence Skin Science Purifying Cleanser. A small facial brush or gauze may be used for the second cleansing. This will deeper exfoliate the stratum corneum before the S30 peel begins. Allow the face to completely dry, and at this point, you may test a small area of the chin or cheek for patient sensitivity level, if desired, to the S30 peel. Protect the lips, nasal openings, nasal labial folds, and lower eyelids with a petrolatum-based product. This should be applied with a cotton swab. Never place a cotton swab that has already touched the patient's face into the salve again. Use the other end if further application is desired, or replace one swab with a new swab. Always protect your hands with latex-free gloves as you apply the Miami Peel S30 directly on to a 4x4 gauze pad. Fold the gauze pad twice and apply enough of the peel to uniformly cover the face or areas to be treated. Remember to begin with the chin, then swipe the jawline, move on to the cheeks, being cautious with the nasolabial fold since that area can be quite sensitive. The Miami Peel S30 should be applied up to the periorbital bone only and not onto the lower eyelids. Apply to the nose and finally the forehead. As an option, you may check for any missed areas with the Woods lamp. Make sure the patient's eyes are closed at all times and ask for feedback as the peel is being applied. The salicylic acid in this peel will become warmer and the client will feel it peak for approximately 3 minutes. If more peel needs to be applied, discard the used gauze pad and begin with a new one. Never leave your patient unattended during the peel process, and check to see if the area being peeled is excessively red, and remove immediately with cool water if this is the case. Always listen to patient feedback with regard to any levels of discomfort. Avoid fanning treated areas during or after the peel application, as this will diminish the efficacy of the peel by accelerating the self-neutralization product. This peel is self-determining and will shut off in approximately 3 to 5 minutes. At this point, you may remove the peel with our Quintessence Skin Purifying Cleanser and bring the pH back with our Quintessence Green Tea Toner. The toner will rehydrate the treated areas as well as make further product applications easier and smoother. If a mild microdermabrasion and or extractions are part of your skincare protocol, this would be the appropriate place for beginning this process. Wait until the Quintessence Green Tea Toner has dried before beginning this next step. Tone the skin again after extractions or microdermabrasion for a very soothing effect. Once the skin has calmed down and is still damp from the toner, apply our Clarifying Under Eye Serum Capsule. 1 capsule is enough for both lower lid areas and do not apply to the upper lids. Begin a gentle 5-minute facial massage using approximately 5 to 7 pumps of Quintessence Serum C formula. This will slough off any remaining residue from the peel and also embed the Serum C deeply into the epidermal layers. Do not skip this step. As an option, you may follow with 3 minutes of high frequency over gauze. High frequency kills any remaining bacteria and helps close any opened areas, tonifies the pores, embeds the Serum C deeply into the epidermis, tightens the skin, and gives it a radiant glow. Follow the massage with the application of Quintessence Q Sunshade Sunscreen. A small amount of the sunscreen may be placed onto the lower lids as well for further sun protection. This is the completed protocol for medical estheticians and nurses. Physicians will typically only follow this protocol up to and including step 6 adding the sunscreen as a finishing for further protection after the peel.
Hi, how you doing? Now you've had your peel. Your skin's a little bit rosy. It's going to feel a little bit tight, but that's normal. That's what we want. We're going to give you some instructions that we want you to follow at home. Avoid the sun, apply the creams, and you should have a great result. Okay? We'll see you back in 2 to 3 weeks, and we'll go ahead and do this again. All right, great.